Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Influenza, flu. Introduction. Influenza, also known as the flu, is a contagious disease that is caused by the influenza virus. Infection with influenza viruses can result in severe illness and life-threatening complications, but most people recover within 1 or 2 weeks. This program will help you understand this disease. It discusses the causes, symptoms, diagnosis, treatment, and prevention of flu. What is flu? The influenza virus causes flu. A virus is very small and can cause infections in humans. The human body fights such viruses by forming protective antibodies. The flu viruses attack the nose, throat, and lungs in humans. They spread from person to person. When a person who has the flu coughs, sneezes, or speaks, the virus spreads into the air where other people can then inhale the virus and develop flu. The viruses can also be spread when a person touches a surface with flu viruses on it, such as a door handle, and then touches his or her nose or mouth. Most people who get influenza will recover in 1 to 2 weeks. Some people will develop life-threatening complications such as pneumonia as a result of the flu. Certain individuals are at higher risk for developing flu complications. People at high risk for developing flu complications include people aged 65 years and older, pregnant women, children between 6 months and 23 months of age. People of any age who have chronic medical conditions such as heart, lung, liver, or kidney disease are also at high risk for flu complications. People who have suppressed immune systems from chemotherapy for cancer, immunosuppressive medications such as prednisone, or HIV are also at higher risk. Hundreds of thousands of people worldwide die each year from complications of the flu. Symptoms and diagnosis. When flu viruses enter the nose, throat, or lungs of a person, they begin to multiply, causing symptoms of flu. Flu usually comes on suddenly, and its symptoms may include high fever, headache, tiredness or weakness, which can be extreme, dry cough, sore throat, runny nose, body or muscle aches. Diarrhea and vomiting can also happen. This is more common in children. Colds and flu are both highly contagious, and in the initial stages, a bad cold and a mild case of the flu might seem alike. But unlike colds, the flu is a serious illness that can have life-threatening complications. Your healthcare provider can often make the diagnosis of influenza based on your symptoms. Additional testing for influenza might be done if the diagnosis is not clear, you are at higher risk for complications related to influenza, or if you need to be hospitalized.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Complications of flu. Some of the complications caused by flu include bacterial pneumonia, dehydration, and worsening of chronic medical conditions, such as congestive heart failure, asthma, or diabetes. Children may also get sinus and ear infections. Treating flu. If you are considered to be at high risk for complications from the flu, you should consult your healthcare provider as soon as you get flu-like symptoms. Most patients recover from influenza by getting rest, maintaining their fluid intake, and giving their immune system time to get rid of the infection. But for those individuals who are at higher risk for complications, or who have a severe disease, a healthcare provider might prescribe an antiviral medication. In general, antiviral treatment needs to be started within the first 2 days of your illness to reduce the duration of the illness. The treatment lasts for 5 days. If you develop flu-like symptoms, but you do not have an underlying medical condition, you can help your body fight the infection by getting plenty of rest, drinking a lot of liquids, avoid using alcohol and tobacco, consider taking over-the-counter medications to relieve your flu symptoms. Children or teenagers with the flu should get plenty of rest and drink lots of liquids. The medicines that they take to relieve their symptoms should not contain aspirin. Never give aspirin to children or teenagers who have flu-like symptoms, especially a fever, without first speaking to your healthcare provider. Giving aspirin to children and teenagers who have influenza can cause a rare but serious illness called Rye syndrome. To avoid spreading the disease to others, stay home and avoid contact with other people. Cover your nose and mouth with a tissue when you cough or sneeze. If you don't have a tissue, cough into your sleeve or elbow rather than your hand. Wash your hands with soap and water or use an alcohol-based hand sanitizer to clean the germs off your hands. Emergency signs. There are some emergency warning signs that require urgent medical attention. In children, some emergency warning signs include high or prolonged fever, fast breathing or trouble breathing, bluish skin color, fever over 100.4 degrees Fahrenheit with vomiting, diarrhea or dehydration, sore throat and trouble swallowing, a deep cough with lots of mucus, initially gets better, then gets worse again. You should also seek immediate medical attention if you notice changes in the child's mental status, such as not waking up, not interacting, extreme irritability and not wanting to be held. Your child has seizures. If your flu-like symptoms improve, but then return with a fever and a worse cough, seek medical attention as soon as possible. This is true for both children and adults. In adults, some emergency warning signs that need urgent medical attention include high or prolonged fever, difficulty breathing or shortness of breath, pain or pressure in the chest. In adults, some emergency warning signs that need urgent medical attention also include near fainting or fainting, confusion, severe or persistent vomiting. Get immediate medical care, call your healthcare provider, or go to an emergency room if you or someone you know has any of these. The signs described in this section: a worsening of existing medical conditions, other unusually severe symptoms. When you arrive, tell the receptionist or nurse about your symptoms. You may be asked to wear a mask and sit in a separate area to protect others from getting sick. Preventing flu. The single best way to prevent the flu is to get vaccinated each fall. If this is not possible, there are some other ways to protect against flu. The following steps may help prevent the spread of respiratory illnesses like flu. Avoid close contact with people who are sick. When you are sick, keep your distance from others to protect them from getting sick too. Stay home from work, school, and errands when you are sick. You will help prevent others from catching your illness. Cover your mouth and nose with a tissue when coughing or sneezing. It may prevent those around you from getting sick. Wash your hands often. This will help protect you from germs. Avoid touching your eyes, nose, or mouth. Germs are often spread when a person touches something that is contaminated with germs and then touches his or her eyes, nose, or mouth. Flu vaccine. The flu can be prevented through the use of the flu vaccine. It helps the body develop immunity to flu. In the U.S., the vaccine is best given before winter, which is when the flu becomes widespread. That is why flu shots are usually given in October or November. Every year there are different types of influenza viruses that can cause the flu. Scientists prepare a new vaccine for each flu season. The vaccine prevents the 3 viruses that will be most likely to spread. The flu shot contains inactivated or dead flu viruses. It is recommended for people who are at high risk of developing serious complications from flu. Side effects from the flu shot are rare, except for redness or soreness in the area where the shot was given. A few people, especially those being vaccinated against influenza for the first time, may get a mild fever, headache, and flu-like signs such as aching muscles. These reactions start in 6 to 12 hours and last 24 to 48 hours. Some people should not get the flu vaccine without first talking to their healthcare provider. These include people who have a severe allergy to hen's eggs, previously developed Guillain-Barré syndrome or GBS within 6 weeks after getting a flu shot, have a known allergy to influenza vaccine or its components. There is a nasal spray form of the vaccine, and it contains weakened live flu viruses. It is called the LAIV4 or live attenuated influenza vaccine. The number 4 means that the vaccine protects against 4 different types of flu viruses. The nasal spray flu vaccine contains live but weakened influenza viruses. When the viruses are sprayed into the nose, they stimulate the body's immune system to develop proactive antibodies. These antibodies will prevent an infection caused by naturally occurring influenza viruses. The following people should not be vaccinated with LAIV. People less than 2 years of age. Children aged 2 to 4 who have asthma or who have had wheezing in the last year. People 50 years of age and over. People younger than 18 who are receiving aspirin or salicylate-containing medication. The following people should also not be vaccinated with LAIV. People with a history of Guillain-Barré syndrome, pregnant women, people with a history of allergy to any of the components of LAIV or to a prior dose of any flu vaccine, individuals who have a weakened immune system or caregivers of severely immunocompromised people, people who have taken antiviral drugs during the past 2 days, people with underlying medical conditions, including asthma, heart disease, diabetes, or an acute illness should ask their healthcare provider before receiving LAIV. In children, side effects of LAIV can include runny nose, headache, vomiting, muscle aches, and fever. In adults, side effects of LAIV can include runny nose, headache, sore throat, and cough. Flu vaccination is important during the COVID-19 pandemic to reduce your chance of needing hospitalization. It may be possible to take this flu vaccine with the COVID-19 vaccine. Check with your healthcare provider.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Influenza or flu is a contagious disease that is caused by the influenza virus. Infection with influenza viruses can result in severe illness and life-threatening complications. Symptoms of flu are similar to those of a cold, but are more sudden, more severe, and usually include high fever. For healthy people, resting and drinking plenty of fluids usually allows the patient to recover from flu. For people at high risk of developing flu complications, medications and hospitalization may be needed. Flu shots are available and are recommended for all people who are aged 6 months or greater. A nasal spray vaccine is also available for healthy people between the ages of 2 and 49 years. Flu can be prevented by avoiding close contact with sick people and by washing the hands frequently. If you have the flu, you can help to stop the spread of this infectious disease by staying home while you are sick and by covering your mouth and nose as you cough or sneeze. Thank you for using Explain.